Thank you for joining today's session on sexual wellness decoded. We're going to talk about all about contraceptions and conception. The session will help you understand the several aspects to sexual well-being, as often this information isn't available or isn't accessible to all because of the stigma around the conversation. Before we begin, allow me to take a moment to introduce NOAA. NOAA is an employee wellness platform, and our core focus is centered around health insurance. We also assist organizations in improving overall employee well being through a variety of wellness programs, such as daily fitness and mental health counseling. We host regular sessions to create a holistic sense of wellness with our physical, emotional, finance, and chill sessions like live music and comedy sessions. Today, we have Dr. Theertha, who is an obstetrician and gynecologist with over 8 years of experience. She completed her MBBS from KS Hegde Medical Academy, Mangalore, and KEM Hospital, Mumbai, and completed her MS Obstetrics and Gynecology from Rajiv Gandhi University of Health Sciences. Her areas of expertise include PCOD, PCOS, C-section, pregnancy, laparoscopy, endoscopy, and infertility, among others. We are very glad to have Doctor with us today. And if you have any questions during the session, please feel free to drop them in the chat box. And we are definitely going to take them up towards the end. But feel free to drop it during the session and we'll definitely get to it at the end. I hope all of you have a great session, and over to you, Dr. Theertha.
Start?
Yes, you can start.
Okay, let me begin by asking everybody who's in the session a question. Why do you think sexual wellness is important? Now, sexual wellness or taking care of your sexual health includes contraception, it includes preconceptional counseling, preconceptional advice. Why do you think it's important? I think you can drop your answers in the chat. Yeah. So, anybody there who wants to tell me why it is important? No? Nobody thinks it's important. Yeah, very nice. SAP to prevent STDs, yes. Apart from that, yes, excellent. Population control. We are a country which has the second highest population in the world. I think it's about time we take care of our population. And with the inflation increasing day by day, I think it's very important that we make sure that our resources reach everybody. And then the next thing is to avoid an accidental pregnancy. An accidental pregnancy can be an emotional as well as a financial burden. Yes, Merin has mentioned that to know the risks. It's very important that we know our own body. It's very unfortunate that so many of us don't know what is in our body. So it's important that we know, it's important that we avoid any accidental pregnancies. Now, according to the WHO statistics in 2019, there was a 1.1 billion women who were in need of contraception, out of which about 850 were using contraception, but there was still an unmet need for contraception in about 240 million. Now, as mentioned in the slide, more than 851 million women or girls use contraception. As per a survey done, 1 in 8 couples globally struggle with infertility, and 1 in 7 unplanned pregnancies globally occur in India. There was a survey, which is the National Family Health Survey, also known as NFHS, done in 2015 to 2016, wherein a survey was done among men and women in the reproductive age group, which is precisely between 18 to 49 years of age. In that survey, it was shown that about 75% of married men do not believe in using contraception. And this survey was done in states like Maharashtra, Bihar, Orissa, Madhya Pradesh. And it was sad to know that the male sterilization rates were as low as 0.3%, while the female sterilization rates were 36%. So can we move on to the next slide? What should you expect from this session? This session is going to give you a cafeteria approach. Why a cafeteria approach is we are going to understand and know about the various contraceptive options available. And like it is mentioned, contraception just does not mean just condoms and pills. You'll know that there are a number of other options available. We'll also speak a little about the preconceptional counseling, the tests that could be done, and what you could do to take care of your health. Okay. Now, see, I'll just break a bubble that no contraceptive method is going to be 100% effective, because there is nothing in life that is ideal. However, what should you look for while you choose your contraceptive? It should be easily available. It should be easily accessible. It should be effective. It should have absolutely no or least side effects. It should be readily reversible. It should be effective. And as far as possible, not require any medical supervision. Apart from that, if it has non-contraceptive benefits like helping you with your periods and preventing STDs, it's like a cherry on the top. Can we move on to the next slide, please? Okay. The most widely used, easily accessible, relatively inexpensive method of contraception is your barrier method, which is your condoms. Now, there are male as well as female condoms available. Okay. So, condoms, when used properly, they are 97% effective. And when they are not used properly, they are about 85% effective. What do I mean by proper use? Now, there is no medical supervision required for using a condom. So, you have to make sure that you're using the condom properly. Always apply the condom on an erect penis. Whenever you withdraw the condom, ensure that you have withdrawn while erect to prevent any leakage from the condom into the vagina. Apart from that, if you're using any lubricants, use only water-based lubricants. This myth that two condoms are more effective than one is actually false. It can in fact increase the failure rates. And always be aware that you could be having a latex allergy. If you or your partner are allergic to latex, you may switch over to polyurethane condoms. Female condoms are also available in the market. However, it's an internal condom. It's not an external condom. So it requires a little training. That means you may have to try it on once or twice to know how it is used. Plus, some may find it cumbersome to use. So accordingly, you may choose this method of contraception. Can we move over to the next?
Dr. Theertha, sorry to interrupt you, but your voice is a bit unclear.
Okay. Increase the volume.
Yes, please. That would be helpful.
Just a minute.
I think 2 people have addressed it. Yeah, thank you.
Just a minute. Is it better now?
Yes, much better. Thank you, doctor.
Yeah. So where were we? Yeah, we were at birth control pills. Now, birth control pills are primarily, as they say, pills that control your birth. I mean, anything that is going to prevent a pregnancy from occurring. There are two types of pills that are available. This is based on the hormone content in that. There is combination pills that contain estrogen as well as progesterone. How do they act is depending upon when have you started the pill. They act by either preventing ovulation, or if pregnancy has occurred, you started the pill afterwards, then they prevent by preventing implantation, that is the baby going and sticking inside the uterus. And they also cause your cervical mucus to become thick, which prevents the sperms from swimming inside the uterus. Progesterone only pill or mini pill is only progesterone containing pill. Now that has to be taken throughout your cycle. It does not contain estrogen. That is the difference. It acts by causing thickening of your cervical mucus. The non-contraceptive benefits of contraceptive pills are, you may have seen that they are also given for the treatment of abnormal uterine bleeding. If you have any menstrual irregularities, you're bleeding heavily, if you're bleeding in between your cycles, if you're diagnosed with PCOS, your doctor might advise them for cycle regulation. Even dermatologists advise them for hormonal acne. So these are the non-contraceptive benefits. The combination pills come in either 21-day packs or 28-day packs, which is 21 day is to be taken for 21 days and the next 7 days are for you to wait for your period. While the 28-day pill is 21 days of hormonal pills and then 7 days of pills which contain multivitamins or iron usually. Like mentioned, they are 99% effective. Can you move on to the next? Now coming to intrauterine contraceptive devices. Now intrauterine contraceptive devices are also called as LARC, that is long-acting reversible contraceptive. Because the reversal of fertility, once you remove the intrauterine contraceptive device, is almost immediate. Most of the intrauterine contraceptive devices contain copper. So copper creates a hostile environment for the sperm inside the uterus and prevents a pregnancy from occurring. You may also be surprised to know that it is one of the most effective methods for emergency contraception, which can be put within 5 days of an unprotected intercourse. An intrauterine contraceptive device, there are a number of them, and they can be they are those that can be put for 3 years, for 5 years, or even for 10 years. Implants are progesterone containing hormonal implants. Now there are two types that are available. One is Norplant 2, which is it can be kept for 3 years. They are 2 rods which are put subdermally in your inner arm. They can also be put on your forearm, but usually on your inner arm, which is convenient. That is for 3 years. And then the next one is for 5 years, which are 6 rods. They are small rods which can be inserted into your inner arm. The next one is depot injections. Depot is depomedroxyprogesterone acetate. As the name suggests, it's a depot. So it contains hormone in 150 milligram power or 300. It's a 300 milligram injection. If it's 150 milligram, then it is to be taken every 3 months. And if it's a 300 milligram injection, then it has to be taken every 6 months. Can you move on to the next? This is the permanent method of contraception. Now, if your family is completed, that is, you are not looking to have any more children, and you are looking for a permanent solution. You do not want to use a barrier method, or you do not want to use a hormonal contraceptive, then you go ahead and opt for either a tubal ligation in females and a vasectomy in males. The failure rate is, as mentioned, very, very minimal, 0.5% in women and 0.15% in men. They will not affect your sex drive. They're not going to affect your ejaculation. They are not going to affect your erection. They're not going to have any adverse effects on your body. They are just going to prevent a pregnancy from occurring. That is why if you have completed your family, this is a very, very effective method of contraception, just that it is a permanent method. Coming to the frequently asked questions, what are the options that you have if you want very little or no impact on your hormones? Now, the question is should be rephrased. The contraceptive pills have hormones that are very, very low, and in fact, they are at the same level as that available in your body. Previously, this myth that hormone pills cause weight gain was because of the dosage. The present low dose combination pills contain very low dose of hormones, so they're not going to have any impact. However, if you're looking for a method that has no hormonal component, then the best method is barrier contraception, obviously, that is condoms. If you're not looking for condoms, then the next option is using an intrauterine contraceptive device, which contains copper, that is copper T. And apart from that, if you've completed your family, then the next is a permanent method. This is a very important question. The second one: what happens if you miss your window to take your birth control pills? So listen to this very carefully. If you are somebody who's a pill user, if you missed one pill, then you should take that pill as soon as you remember, and you take your next pill at the usual time, which means 2 pills in a single day. If you have missed 2 pills in the first half of your cycle, in the first 14 days, then you take your pill as soon as you remember, and you use a backup method, that is a condom, for the next 7 days. But if you've had unprotected intercourse in the preceding 5 days and you've missed your pill, then it is important that you use some emergency method of contraception. Now, if you missed your pill in the latter half of your cycle, that is in the last 14 days of the cycle, this I'm talking about a 28-day cycle. If you missed in the latter half, then you start the next pack as soon as you finish this present pack. There is no pill-free period for you. And use a backup method for the next 7 days, that is use a condom. Okay? And if you have any queries, please ask your gynecologist. Do not ask somebody who has no knowledge of the birth control pills. How do I choose which contraceptive I should use? Now, this will depend upon your priorities, whether you are okay with using a temporary method of contraception, that is using a barrier method every time you have intercourse. If you are depending upon your family, how many children you have, the years of married life, whether you want a temporary or a permanent method, whether you're looking for something that is short term or you want something that is long acting, like those who have one child and are not looking to have a child for the next 3 or 4 years, for them an intrauterine contraceptive device is ideal. And depends on if you've completed your family, obviously, then we offer you the permanent method. What are some safe sex practices to prevent STIs? Number 1 is get yourself tested annually. Number 2 is use condoms, barrier methods to prevent STIs. And apart from that, I think do not get yourself a pap smear if you are a cervix owner every 3 years. So that should prevent you from getting human papillomavirus infection, which is the causative factor for cervical cancer. The last question I think I've already answered. How often should I get myself tested for STIs? That is annually. And the test that you should get is HIV, most important. Hepatitis B, if you are not vaccinated, hepatitis B vaccine is available. There are 3 doses. If you are not vaccinated, please get yourself vaccinated. And VDRL, that is syphilis. These are the 3 infections that are most common, and you should get yourself tested for these 3 infections. Can you move on to the next? Okay, preconceptional health. So what is exactly preconception health, or what exactly should you expect from your preconceptional counseling? Whenever you visit your gynecologist, first of all, before you start planning a pregnancy, it's ideal that you go and visit a gynecologist so that you can discuss in detail, you can have a birth plan, you can discuss any concerns that you or your partner may have with respect to your health. You can ask for advice regarding any addictions that you may have, that is smoking or alcoholism. Your doctor might advise you to reduce your weight if your weight is above the normal BMI. They may ask you for a history, that is to exclude any genetic disorders that may run in your family or which may come in your offspring. And they may also ask you to get a few tests done to rule out deficiencies like iron deficiencies, vitamin B12 or vitamin D3 deficiency, which could affect your fertility. You can also discuss regarding any abnormalities or any, when you should start planning, whether you have time, whether you can wait and then start a family, or whether you should start immediately. Can you move on to the next slide, please? Okay. Now, fertility tests. So, if you've gone to your gynecologist, the test that they usually advise for females, it is a blood test. Now, the blood test that they include usually is a complete blood count to rule out anemia, because anemia is very common in our country. Hormonal assay, if you have irregular cycles, then they'll ask you for an FSH-LH testing to rule out PCOS. Then they might even ask you to get T3, T4, TSH to rule out hypothyroidism, which can cause irregular cycles and affect your fertility. They may ask you to get a urine test. Are we going to address the questions at the end of the session, right?
Yes, yes, that's
yeah. So now urine test is to rule out any infections. And ultrasonography is advised to know the status of your uterus and your ovaries to rule out any fibroids or any benign tumors in your uterus, which may prevent implantation, like where the baby goes and gets stuck inside the uterus. If anything is hampering that, then that can be ruled out. Ovaries are seen to rule out any cysts or any polycystic ovarian syndrome. Pap smear is advised to again pick up any precancerous changes or any changes that may be associated with cervical cancer. The doctor will examine you, will do a pelvic examination and a full head to toe examination to rule out any abnormalities. For males, as a gynecologist, I can say that the first test that we do to rule out any male factor infertility is a semen analysis, because that is the parameter which will tell us what is the counts and what is the motility of the sperm. If we think there are any abnormalities in the analysis, then we will go ahead and do a physical examination and a urological examination or a scrotal ultrasound to rule out any hydrocele. Genetic testing is usually advised if you come with a family history of any genetic abnormalities, or if you have a history of recurrent miscarriages, that is at least 2 recurrent miscarriages or pregnancy losses, then we go ahead and get a genetic testing done, because they are expensive. How to track your ovulation? Now, first of all, most importantly, what you should take care of is having a healthy diet and healthy mind and body, most importantly, for getting pregnant. Nowadays, infertility is so rampant that people get anxious very soon. Please remember, the biggest deterrent for your fertility is stress. So don't stress about having a baby or starting a family. Now, some of the methods to track your ovulation most commonly used is tracking your cycle. So how can you track your cycle is, you have to see the last 3 cycles, previous 3 cycles, see the average length of that cycle. For example, if it is a 28-day cycle, then subtract 14 from that. You're going to ovulate somewhere around the 14th. You add 3 days and you subtract 3 days. That is, your fertile period is between day 11 to day 18 of your cycle. And you must try during those days, either every day or at least alternate day. The other method of testing for ovulation is the ovulation testing strips that are available in the market. They basically detect an alert surge, luteinizing hormone, which increases during ovulation. It is a hormone which increases during ovulation. You may start testing 3 days before your expected date of ovulation so that you know exactly when you're going to ovulate. Apart from that, there is an increase in your basal body temperature. If you cannot invest in a wearable, you may use a thermometer. Maybe it might help. There is a very, very minimal increase in your body temperature around the time of ovulation. Apart from this, you may also check your cervical mucus. During your ovulation, your cervical mucus becomes very, very thin and it's very, very stretchy. So you may have noticed this quite often, or if you have not, you can actually observe it during this cycle and see the cervical mucus becomes thin because it's preparing your body for conception. Apart from that, you may have something called as mid-cycle spotting, very, very minimal brownish discharge during your ovulation, which should stop maybe say in 24 to 48 hours. Or you may have a cramping type of pain, also called as Mittelschmerz pain, which will mean that you have ovulated. You may also have a little breast tenderness around the time of ovulation. These are the tiny cues which might tell you that you're ovulating. Now, as I mentioned, small changes to your lifestyle that can go a long way is taking care of your mind, body. If you are obese, if you are above your BMI, please bring it down to a healthy level, because if you conceive and you're overweight, then the complications expected during your pregnancy are higher. What complications, if you may ask? Then they are pregnancy related hypertension. You may even be diagnosed with gestational diabetes mellitus. Your labor process might be difficult. If you are deficient in vitamin D3 or vitamin B12, if you are anemic, please correct them before you get pregnant. If you have higher sugar levels, if your blood sugar levels are increased, it's important that you bring them under control, because if you get pregnant when your blood sugar levels are through the roof, the baby might have abnormalities. And if that is not the case, then you may have difficulties during your pregnancy. Avoid alcohol and smoking. Stop it at least 3 months before you start trying for a pregnancy. And like I said, stress, the most important deterrent. Try to avoid that to help you with the pregnancy, and stay positive regarding your attempts for conception.
Doctor, can we have the first poll? Pooja, can we have the first poll? Okay, let's move on. We'll get back to that. Doctor, you can proceed.
Okay. Can we, 1 minute. It's coming on my window as well. Okay. Up to what age can you try to conceive naturally? This is a very important question. Now, usually above 35 years of age is what we say that your ovarian reserve or your ability to get pregnant starts reducing. Women are born with a limited number of eggs. So beyond the age of 35 years, your chances of conception decrease. I'm not saying it will not happen, but it decreases. So if you are up to 35 years of age and above 30, so up to 1 year you may try. And if you are 35 or 35 years of age, then you may try to conceive naturally up to 6 months. And some health conditions that may affect your chances of conception, like I mentioned, there is deficiencies of iron, vitamin D3, vitamin B12, diabetes, which could be type 2 diabetes or type 1 diabetes that may affect your chances of conception, hypothyroidism, which may cause irregular cycles, polycystic ovarian syndrome, again, which may cause irregular cycles. Now, irregular cycles does not mean that you cannot conceive. Please don't take it in the wrong way. It just means that you may take a little more time and you may require a little more help to get pregnant. Let's talk about assisted reproductive technology. Now, this is a very, very vast topic. I can speak for 3 hours over it, but I will be concise. Now, when you try conceiving naturally and you've tried for a year and you've gone to your doctor, or if you're 35 or above the age of 35 years and you've tried for 6 months already and you're not conceiving, then the next step that we usually advise is an ovulation induction. What is an ovulation induction is, it's another step. We just give you a few medications, oral medications, let me be clear, to help the follicles grow better in your ovary, and we do a follicular monitoring by ultrasonography to see when your egg is going to rupture. This is usually done on day 11, day 13, and day 15 of your cycle. And when the follicle has ruptured, that means you have ovulated, we then tell you that you may have intercourse, because the chances of conception increase between 24 to 72 hours following ovulation. Okay, so that is called as ovulation induction. That the success rate of that is about 20 to 25% per cycle. Now, in a normal menstrual cycle, the chances of conception in every cycle is 20%. Okay. The next step, if you have not conceived even after 3 or 4 cycles of ovulation induction, the next step is an intrauterine insemination. In that, ovulation induction plus, what we do is we collect your husband's semen, we put it in a centrifuge, the sample is centrifuged so that the good sperms or the highly motile sperms come to the surface. That specimen is collected, and the day you're going to ovulate, that day it is inserted inside your uterus. The sperms are inserted inside your uterus with a malleable plastic catheter. The remaining process is the same. The sperms have to swim to the egg and mate with the egg, and the pregnancy happens naturally. This is only one step further. So the success rate of this is somewhere between 11 to 30%. In vitro fertilization is the next step. That is after about 4 to 5 cycles of intrauterine insemination, and they have not helped in getting you a pregnancy. And in vitro fertilization is advised, which is everything is outside the body. You are given injections in an in vitro fertilization cycle to help your follicles grow better, because we need the best follicles for an IVF cycle. Your follicle is monitored continuously, maybe alternate day or once in every 2 or 3 days, to see when they have attained an optimum size. When the eggs are ready and they're about to rupture, that is ovulate, your gynecologist will retrieve the eggs via a small procedure by putting you under anesthesia. Those eggs are then stored in a lab. Then the embryologist will collect semen from your husband. The best sperms are collected, and one by one sperm is injected into one of the eggs, and they are left in a lab to grow, basically making babies in a lab. When the embryo has grown, when the baby is formed and ready to be implanted, that's when we take those embryos and they are introduced back into the mother's uterus, and they have to get implanted by themselves. There is nothing that we are doing for those embryos to get implanted. So the success rate there is about 45 to 50% in 3 cycles of IVF. So no method, like I said, nothing in life is ideal. So there is no 100% guarantee, but that's about it. You can take the questions now.
Thank you so much, Dr. Theertha. That session was really insightful. I'm sure a lot of us in the audience have a lot of questions. I'm going to start with the top. Our first question is it safe to use a control pill?
1 minute. Birth control pill, yes, it's absolutely safe. It's 99% effective. The only drawback that some people have is you have to remember to take the pill every day. In fact, majority have told me that it has helped them with their cycle. It has helped them with their acne. So there are no adverse effects because the dosage of the pills are the same as that present in our body. So they're not going to interfere with your hormonal regulation in any which ways.
Great. We have another question. Does tube litigation lead to hormonal imbalance on later stages? And what exactly is done in that process?
Okay, so tubal ligation is your fallopian tubes. Now you have your uterus. Besides the uterus are the tubes, and then come the ovaries. Ovaries are like they are mangoes hanging from a branch. Your branch is your tube, and your uterus is your tree. That is the simplest form of explanation. So your tube is the communication between the uterus and the ovary. It is the courier for the egg to go inside the uterus. So the tubes are either cut in between and then tied off, or if it is done laparoscopically, then a ring is placed and we pinch the tube off so that the egg that is released, it does not reach the uterus. The hormones are released by the ovary, so that we are not interfering with the ovarian function. So it's not possible that you will have any hormonal imbalance.
Great. We have another question. What are the side effects of pills? I'm guessing they're asking both the birth control pill and the emergency pill.
Okay, so I will start with the birth control pill. Now, the only adverse effect that we counsel women about is nausea. It may cause nausea in the beginning when your body is getting used to it. But apart from that, there is no adverse effect. I've already busted that myth that it can cause weight gain. The only way you can have weight gain is if you lack physical activity and if you are eating right, left, and center and you're not eating the right kind of food. Nausea and headache may occur with a birth control pill. Emergency contraception, on the other hand, is only advisable when your primary method of contraception, that is, if you've used a condom and it tore, if you forgot your pill, then an emergency contraception is advised. The adverse effects, now that you have to remember that the dosage in the emergency contraceptive pill is 10 times of what is present in your normal birth control pill. So you can imagine having 10 times the nausea that you are going to have with the birth control pill. So there is nausea, there is headache, there is irregular bleeding. So you may not get your cycle at the regular time. You may get bleeding prior, and you may be then you constantly worry that you might be pregnant. So emergency contraception has these adverse effects. So please use it with caution. Do not make it a regular habit to use an emergency contraception as a regular method of contraception.
That was really insightful, Doctor. Can we have the second poll, Pooja? Love to see what everyone's thinking right now. Guys, please feel free to drop your questions. We're going to answer each one of them. Great. While the poll is being answered, let's take the next question. Would you recommend getting the HPV vaccine to prevent cervical cancer? What would be the right age to get it?
Okay, so HPV vaccine, absolutely advisable. Ideal age to get the HPV vaccine is before you are sexually active. So the National Cancer Institute, or CDC, as we call the Center of Disease Control, has advised that you take it from 9 years of age. Males as well as females can take the vaccine. This is a very big myth that only females should take, because human papilloma virus is not just responsible for cervical cancer, it is also responsible for genital warts, anal cancer. Now, in India, cervical cancer is the second most common cancer. That is why we stress so much upon women taking the vaccine. You can take it at any age from 9 to 45 years of age. If you are already sexually active, then it is not that effective as it would be if you had taken it before you were sexually active. But it will definitely prevent new infections from occurring. So it is advisable. There are 3 doses that is to be taken at 0, 2, and 6 months. Please go ahead and take it. The vaccine that is available now is Gardasil, and even Gardasil 9 is available. So I'll definitely recommend it.
Thank you, doctor. The next question we have is, can an expecting mother get the COVID vaccination? I think I'm going to add on one more question. Can they get the booster doses as well?
Yes, of course. Whenever booster dose is available for pregnant mothers, as of now, it's not available. It's only available for healthcare workers and those above 60. The booster dose I'm talking about. The COVID vaccine has already been approved by the WHO as well as our own Ministry of Healthcare. So pregnant mothers, many of them have already taken it. So please go ahead and take the vaccine. There's no harm. There's no adverse effects reported yet.
Right. Next question we have is, can you talk about endometriosis? Can women conceive if they are detected with endometriosis?
Okay, so endometriosis is another, you can have another session on it, and I can talk for around 3 to 4 hours about it. Basically, endometriosis is just like we bleed during our cycle. Sometimes, owing to various reasons, you may bleed internally inside your abdomen. That's what is endometriosis. That is the endometrial tissue, that is the inner lining present outside the uterus. So, depending upon what stage of endometriosis it is, and what medications, what treatment you have taken for endometriosis, how many years since you've been trying, whether you have tried medical management, what it takes a lot of things into. Of course, you can get pregnant with endometriosis. In fact, pregnancy, if you get pregnant, endometriosis will not act up because all your hormones get suppressed. So you can get pregnant with endometriosis, definitely. But how you should get pregnant and what is the treatment plan, your gynecologist is the best person to help you out with that. Go ahead and talk to your gynecologist regarding it.
Thank you, doctor. We have one question. Can't we take HPV vaccine after 26 years of age? Also, is there some visible proof that we took it in childhood?
I'm sorry, I didn't.
I'll repeat the question. Can we take HPV vaccine after 26 years of age? Also, is there some visible proof that we took it in childhood?
Okay, so the vaccine was approved by the FDA only say in 2013 or 14. Now, if you were born afterwards, then you may have received the vaccine. You should ask your parents about it, because HPV is not included in our national immunization schedule for whatever reasons. I will not go into that because that's another discussion altogether. If you were born before that, If you are a 90s kid or like me, then you have not received the vaccine. Please be sure of it. And it will not, the data will only be available with your parents. It will not be there in your immunization card. So you can take the vaccine. Like I said, anybody from 9 years to 45 years of age can take the vaccine.
Great. Next question is, which oral contraceptive is safe for regular use?
I am not going to propagate any particular company, but there are various generations of pills that are available. There are 4 generations altogether. So every obstetrician or gynecologist will prescribe a pill based on their comfort or whichever they have seen in their experience and have found to be better. All oral contraceptive pills contain estrogen and progesterone. So based on what your gynecologist advises, and after you start using the pill, seeing what whether it's well suited for you, accordingly they may give you the pill. So there is no particular best contraceptive per se.
Understood. Can fibroid cause complications during pregnancy? Precautions, if any?
Okay, so fibroid is a benign tumor. Benign means non-cancerous tumor. But when you have a fibroid, it depending upon the location of the fibroid, depending upon the size of the fibroid, accordingly, I can tell you whether it's going to cause a complication during your pregnancy. Basically, it's a space occupying tumor. It is occupying the space where your baby is supposed to grow. You know, it's like 2 people sitting on 1 chair. That is what the fibroid is going to do to your pregnancy. So accordingly, the doctor will advise you whether you can, whether you should conceive with that fibroid or whether you should get the fibroid removed first and then conceive. So like I said, it's the best that you consult your gynecologist with your report which shows the fibroid.
We have a follow-up question on HPV vaccine. It says, will taking the HPV vaccine cause any side effects? Also, from where should we take it?
Okay. Most gynecologists have the vaccine with them. It's available with all the gynecologists. And regarding adverse effects, until now, I haven't seen anybody having any adverse effects. I myself, when I took the vaccine, probably I had pain at the injection site for a day or 2. But other than that, nothing.
We have a question about a particular medicine. I don't think we can take that up, but I think I'll just drop it. Is meprate a safe medicine to take? It's spelled MEPRATE.
It's progesterone. So, like I said, I cannot propagate or say talk against any drug. It's not my place to comment about any drug. I can obviously talk about progesterone. Progesterone is a very safe hormone. I mean, it's produced in your body, so how can it not be? How it all depends upon the dosage. So, yeah, you should talk to your gynecologist again.
Okay, we have a question: how to abort unwanted pregnancy?
How to abort the unwanted pregnancy is, I'm sorry to be sarcastic, but first visit a gynecologist, a registered medical practitioner. Please don't try anything at home, and you don't want to end up being sorry. What your doctor will do is they might ask you to get an ultrasound done. One is to know the location of the pregnancy, because sometimes the pregnancy might get implanted in your tube, what we call as an ectopic, which is not a normal pregnancy. So first of all, to know the location, and the next it is to know the duration of the pregnancy. I mean, how many months pregnant are you? And accordingly, they will advise you regarding medical termination or surgical termination, depending upon the duration and the location of the pregnancy.
Can HPV be cured?
See, HPV is a viral infection. Why we ask you to get a pap smear done regularly, why we ask you to get a vaccine is because if you are infected with HPV, which majority of us who are sexually active are, it clears spontaneously. Your body has the capacity to clear the HPV infection spontaneously, but it takes somewhere about 4 to 5 years for the HPV infection to get cleared. What causes cervical cancer is persistent human papilloma virus infection. Persistent is the key word. When you keep getting infected repeatedly, that's when your body reacts to it. It gives up to the cancer. Basically, it gives up to the virus. When the virus wins, when your body is incapable of treating that infection, that's when it goes about and results in the precancerous changes and results in cervical cancer. So your body is fighting the infection. Your body is trying to clear the infection. So obviously HPV infection can get cleared. Pap smear is to pick up the precancerous changes faster, number one, so that it can be treated, picked up quickly, and it can be treated. And the vaccine is to protect you against the infection again.
Correct. So we have a question. Can you talk about DNC surgery? Is it painful?
I'm sorry?
Sorry. Can you talk about DNC surgery? Is it painful?
Okay, I have to leave in another 5 to 10 minutes. I have a case lined up. So can you
we'll wrap up in
we'll
just wrap up. Yeah.
So DNC is basically done. One is there are various reasons why we do a dilatation and curettage. It could be to terminate a pregnancy, number one. Other than that, if you have a thickened lining, or we want to collect the endometrial tissue and send it for testing if you think something is abnormal. So it's done under anesthesia again. You will be put under general anesthesia. We dilate the cervix. We open up the cervix so that we can go inside, collect the tissue and come out. Or we can go inside and remove the pregnancy. So that is called as curettage. Curating means, cleaning up the uterus. So that's what a dilatation and curettage is. It's about 15 to 20 minutes procedure, and it's a day care procedure. You get admitted in the morning, you can go home in the evening.
Okay, guys, last question I'm taking up. Does taking HPV vaccine depend on when second dose of COVID was taken? Should we keep some time space between the two?
No, not necessary. It has not been given in any research that you have to wait. You can take the vaccine immediately. But if you've had any adverse effects of the COVID vaccine, like fever, or some people have reported feeling cold or having fever or weakness, then you wait until you recover from those symptoms and then take the HPV vaccine, is what I'd advise.
Great. Thank you so much for your time, Dr. Theertha. This was a very, very insightful and knowledgeable session. Thank you everyone for joining today. We keep having a lot of similar sessions, physical wellness, mental wellness, and also social sessions towards the end of the month. We look forward to having all of you and your colleagues join us. The link has been shared by my colleague in the chat box. Please do register. And again, thank you so much, Dr. Theertha, for your time and knowledge. We look forward to having you again. Thank you everyone for joining.